Welcome again. This is Joanna and Brian here from Florham Park. Yet again, another recording session. Today's recording will be somewhat exciting and hopefully quite helpful to many of you. It's a topic based on a lot of questions that have always come our way and what to really look forward to from your initial appointment with us. What does the initial appointment with the therapist look like? And we're going to talk from our perspective, letting you know what we usually do on your first visit, or maybe a little bit prior to your first visit, so that way you feel a little bit more comfortable coming in should you need a counseling session. And to start off, Brian and I figured that it would be good to talk about some of feelings that come up before scheduling your first session. And a lot of those feelings are that of worry. Should I be calling? Should I be scheduling? Anxiety about coming in. Is something wrong with me just because I'm scheduling a session? By the way, not really. No, it's not. So to let you know, before we proceed with the bigger picture of what to expect from your first session, is to talk about some of these feelings. So, and me and Brian will talk about this, and we do always say that, or we do bring this up, that worries, stressors, and anxiety of scheduling a session is actually the hardest. To schedule an actual session is the hardest. Once you schedule one, everything seems to flow a little bit better. It's usually that first step, scheduling a visit and actually following through, that is the hardest for many of us. Right, Brian? And I'll give you some of
Yes, absolutely.
Yeah. Mm-hmm.
Yeah, I think, just to normalize, like you had said, normalize the anxieties that come up and the wishes that come up before a session. Like transference, as we say, right? Emotions that are put onto that first initial call. And then even before that initial call, there are many contemplations of whether a person makes a call, whether they actually look up a person or, to make that call. There are all kinds of questions as to what is it that may come up in session, and they may not go deep into those thoughts, but there is a sense of fear to make that call, and that can be what prevents them, or the resistance, as we call it, to making that first call. Because there may be wishes as to wanting to work through stuff, but then there's also going to be those questions like, will this person who I'm going to speak to understand me? Will there be judgment? And of course, often there's that fear of judgment, and who wants to be, right? There is shame, there is vulnerability, depending on what they're coming in. But the majority of whom, at least I've worked with, they're coming in for a decision making that is bringing up some sense of concern. Some come in with depression because of a breakup or for a loss. Mm-hmm. And then others come in with work stresses and anxieties. Mm-hmm. And then there are others, which is frequently the transitions that they're making in life. Yeah, so in regards to that, right, the transference, every client comes in with that initial call. And just because they've made that call doesn't mean that they're going to follow through.
Yeah, and right. You're bringing this up because one of the common approaches are, and I think we're also speaking from ourselves. We've been doing psychotherapy for a long time, or long enough to know this, that a lot of times many individuals seek a therapist before even scheduling an appointment, and they seek few. And sometimes they base it on gender, right? Do I want a female therapist or a male therapist? We could talk about that too, because is there necessarily a preference or versus the understanding that your therapist has about you and how your relationship forms in therapy? So I think I'm speaking from a sense of, I think that would be probably the one of the bigger concerns that someone might have. Not concerns, but at least the research, right?
Right, the relatedness.
Yeah, yes, how I can relate to you, what is your background? And most of us therapists, I know we do, we have our profile on Psychology Today, where we are able to express ourselves and what we do and some of our background information. And we do it for a reason. So that way our clients, future clients, can get to know us a little bit through that. And then, of course, the part of scheduling a session. And like Brian said, we can schedule sessions that it doesn't necessarily mean that we'll follow through with it. And that's a part of character. That's a part of stopping for a reason, not necessarily being ready to start or not yet, or maybe later. But it's also to let you know that even if you think about therapy, it's just a part of you that's curious about yourself and what is it that's not working in your life and how you would want to make it work, how to make yourself feel better. And the fact that you're already thinking about it prior to scheduling is good enough. That just says that you are quite in tune with yourself and your needs, I would say. Right, Brian? I don't know if there's anything.
Yes, I think the function of psychotherapy also, it takes courage. It does take courage to seek out help, for one, right? Because it's going to bring up some vulnerabilities that we may or may not be ready. And sometimes ignorance is bliss. We come and then we may not know how deep actually the process may be, and it's not as simple as we'd like it to be. But there is something to be said about how one truly is in that mode of self-care, that I want to take care of myself and I feel like I'm ready for it. So there's a certain readiness, right, that comes with having, and that readiness may be because I can't handle this stress anymore, because it's manifesting in anger and in depression, in anxiety. I can't wake up in the morning. I feel my work is not purposeful anymore. It's mundane, and I'm looking to expand on my best self, but I'm unsure about who I am and what am I capable of. And that's, as part of our process when we are going to make that appointment, if the client agrees to work with us, in our set of registration forms is an assessment of the Myers-Briggs, so that we can very quickly identify what their character strengths are as we are working through their problems, so that patients know that at least from a value base already before they begin the process, that they are going to get an assessment that identifies their character strengths, that they won't be as vulnerable, and that we will remind them of their existing character strengths, and imagine what more will come up from character analysis.
Yeah, and I don't know, if many therapists do this. I know we do this, right? Where even before we give this assessment, and that goes with the paperwork, the registration paperwork, which sometimes can be overwhelming. I think, once again, who likes paperwork, right? You have to answer some of the questions that you may not necessarily feel comfortable with, but once again, it's there for a reason that these questions are there. And what's also good about this is that initial phone call. Once you are able to get on a phone call, whether it's with me or Brian, is we commit those minutes. I think on average we say 15 minutes. I happen to sometimes, I know for
it's more than that. Yeah.
Sometimes it's more than that. I think it depends on the client, the needs, but to also, so that way the client can hear me, how I speak, and how I would say probably in tune I am to the client's needs, but also vice versa is, what is it the client is seeking from me, and am I able to provide to them? And I think this is also the part of how compatible we are, right? To determine through this consultation, is this a great fit for both of us to move forward, to schedule a session. But the initial, once again, the next step is, once you research the therapist, once you find 5 therapists to call or 10 before making your appointment, is have that actual conversation with the therapist on the phone, because that's another step, and you can hear their voice. We can hear your voice, and from there we can also already through that, I think, can minimize some of those stressors of coming in just by that initial session. I've noticed it for, when I speak to my clients before they come in.
Yeah, I think sometimes that initial call, that consultation call, it can either show, some sense of whether we are matched or not, but it also allows for some of that anxieties towards that first appointment to be reduced. Because that even if it's a 15-minute conversation, one can tell from the intonation and the inflection and the inquiry and the curiosity that we have in that conversation about how can I help you? How can I best help you? Are we a match? And so that there is no sense of obligation, right? There is just a curious inquiry and discovery to answer some of those questions that a client may have, and to lower some of the anxieties that may get in the way of successfully coming through and making an appointment.
And I've noticed for myself, I just recently, I think last week, I had a client calling in, and so I think this is so fresh in my mind that I'm saying, I'm hearing their needs and what is it that they're struggling with, but also the part of what coping mechanisms have worked for them and then what no longer works. And I kind of go over that with them on the phone, but I also let them know how I work and, my commitment towards them. And then I always, at least I notice that, and sometimes most of the time I conclude by saying, how you feel about coming in after now that we had this, consultation session. And most of the time, actually, I'll say all the time, all clients, want to schedule a session, and then we schedule a session and go from there.
I totally agree. I think having that conversation and just, sophisticated ignorance, right? We may know everything, and we may have gone to school to study this, but we really don't know. And it's really the patient who is the expert and master of their lives, and that the conversation we have has a combination of empathy and appreciation of their courage, as well as maybe from our part a sense of empowerment that we can see how courageous they are, and that we can cheer them on, inform them on, support them on this very courageous journey.
And I think that, for both of us, once we're able to have this phone consultation, I think both of us usually proceed with then asking the client, asking the viewers what your email address is, what the best way of communicating with you is, so that way we can provide you with the paperwork. And we normally, and we did this before COVID, before telehealth began for us, where we emailed the paperwork. And we do it so that way we can prevent any paperwork to be done in the office, so that way we don't lose any time with you. We try to make sure that all that paperwork is completed prior to you coming in, so that way you have all the minutes that you deserve in our session. And I feel like that works so well, and clients are very appreciative of that, because we don't have to go through the paperwork. I mean, once again, we don't have to go through the paperwork, but there's a part of it that we do go through it, and that is when the client comes in. When you finally schedule a session, you come in. And by the way, viewers, Brian and I, we follow a very structured routine. That's our JNS, where once we schedule an appointment with you, we try to make sure that that slot belongs to you and you only, so that way we don't have to change too many dates days or times, because we don't want to confuse ourselves. We don't want to confuse you. We want to give you something that you can look forward to, and that time is really yours, that it belongs to you. So once you come in, what to expect from your visit, and that goes with the paperwork, with the HIPAA compliance and policies that we then explain to you how we follow. And I'll leave this to you, Brian. I think you can probably explain it in a little bit more detail, or how when we sit with our clients, when we go through the paperwork, which once again, not so fun. Who likes paperwork? So we need to fill out paperwork. That kind of goes with this whole, life purpose of, there's things in life that we don't like to do, but sometimes we just have to do them, and paperwork is one of them. And
I think, to be compliant with our boards and our the guidelines that is kind of put on us as well, so that there is a check and balance to doing job well, right? There's often a registration form, and then there is the consent form. And the consent form, the informed consent form, includes all the policy and procedures, confidentiality, about what we talk about and what are within the limits of one thing that is not in the limits of within the protection of confidentiality. If there is a danger to self, others, and property, right? That's a simple one that people may not know, but it's good to be able to review this information, because we also have a client purpose "Who am I?" questionnaire. Gets you to contemplate and think before the session about what your strengths are. Do you know what they are? What would you like to work on in the short term and in the long term? Do you know what are the ways that get in what sabotage do you recognize within yourself? What could sabotage the process? And that gets the patient to already start thinking about what to bring into that session. 3 things that I like to talk about. We may only cover one, but at least there's a certain preparedness, right? Or contemplation to where I want, what I want to talk about. So of course there is the registration form, which is or the intake form, which talks about, do you sleep well? Questions about your, smoking habits, if you have them, your drinking, relational habits, your spiritual or religious habits, about family history. And that gets clients to start thinking ahead already about a holistic approach as to what their life has been, because, we want to pivot towards their life from who am I now, and sometimes we may have to work on some of the family history stuff or the client's history, but we don't want the past to really define the future. We want them to know it is their character strengths that defines their destiny, not so much their trauma that defines it. May influence, but there are other parts within them that can carry them through. And so when a client comes into session, into an office space, it is at least in our practice, when the client has already completed the form, and hopefully they're able to email us that in advance, we get to review that already. So there's a preparedness in our own minds as what is this treatment plan? What is the treatment plan or the journey with the client going to look like? Of course, it's a collaborative process, right? It's who are we to define? We are not so arrogant to define that we have the answers, but the client has some sense of preparedness as to what is it that they want to clarify? What are the belief systems that seem to get in the way? And we too can have an outside perspective as they have done the work and what they have written down as a way to I see certain patterns of words, certain feelings, certain beliefs that are already presented, and we too can be prepared for a session. So that initial session is already a informed and thought out charged process, right? That the therapist has already have an idea of where can we go with this conversation from a place of curiosity, and the client is not so clueless as to what to expect in the session. He or she can expect, or they can expect, a certain set of goals to be processed and talked about.
And I think also what you're saying is, for our viewers, is that this is the way you work. How some of this paperwork helps us, and maybe I don't know if I want to say fast forward the session, right? That it almost puts the session a little bit further in, just because we have some of this baseline information. I can't speak for all therapists. It's just that we are talking from our perspective that by doing this paperwork, we already get to know you. We already get to know you by a phone consultation with you. We all have almost like an image formed before we meet, and then when we meet, before we meet, we have the documents filled out. So we already have an idea of what to look forward to in a session once you come in, and also for what you, the viewers, can expect from us. And that's something that I think I appreciate as a therapist, that I'm able to do before I actually proceed having my clients come in. I think then I'm speaking for once again. I can't speak, for all my cases that I've had in so many years, that in most of my cases, I'd say that clients usually feel very relaxed once we have the consultation, once the paperwork is filled out before they arrive. So there's almost like a release of anxiety before I come in.
Yeah, because you're getting ready, and so you feel more prepared and informed. But then there is the other process, right? Whether it's telehealth and whether driving to the office for a face-to-face appointment, both have their own set of readiness or preparedness and their own set of anxieties. Like if you're coming to a place that you're not familiar with driving wise, it's helpful to at least look up what is the in Google Maps or Waze or whatever, what does it look like? And some clients truly do feel that they are directionally handicapped. I am one of them. What was the world like before? I mean, I do remember before, navigation, but, there's a certain readiness that, okay, I know where the location is so I can be on time, right? And kind of plan out what traffic is going to look like and all that, so that they can be there, a few minutes early and not coming in, rushing, so that they get to settle down in our waiting area where there is soft meditative music and they can center themselves, and to think about the happier, healthier, and successful version of them before they start the process, right? So that the brain is already given an instruction that while we may be talking about some really difficult issues, at least the brain has been given a vision of what the outcome. This is who I want to be. This is who I want to resonate. These are the kind of beliefs, healthier beliefs I want to be able to have. And I think that purposeful waiting is important to the process, right? And then, of course, in telehealth, then the client, as we instruct them, try and make sure that your phone is charged, or whether it's a phone session or whether it's a virtual conversation, that they have some privacy and that the family should be known that, okay, I'm going to have an appointment, so don't interrupt me for the next 40 or 50 minutes, right? And they might need to be able to speak in the car and to try out the Wi-Fi and all that kind of good stuff. Before I use Doxy, but of course there are so many other platforms like Zoom and Skype and Meetup by Google and all. I think, to be able to use that technology and see that, especially for the older clients, and I was totally clueless about stuff, and I had to make sure that I was ready, technology-wise, to be able to, right?
Very much so.
Yeah.
A 15-year-old will probably be able to do a lot of these platforms and be able to use the computer a lot better than we do. So for us, it was definitely a challenge. Just to kind of piggyback on what you said, and it was so great when you said it is the part of being in person versus telehealth. And yes, age is a factor in this a lot, because with children is the ability to have confidentiality, right? The room, the space, so that they're not interrupted. So children is one, and we can cover a whole session on this too. Adults, those that are elderly and don't know necessarily how to use a computer, that can be difficult as well, especially once again. But maybe I don't know if I'm necessarily talking about the mid-age. Our group is the common in from when you're, once again, let me rephrase my words. To be in a session or to come in and sit in the hallway in a waiting area, a lot of my clients miss it, because I do telehealth, right? Most of my clients are your clients, I'm sure, is telehealth. And one of the things that comes up is I'm still worried about coming in, but I do miss the part of waiting in a waiting area. It's the part of, you said, the music, or how I guess at the same time for those new clients is the ability to almost fantasize what the therapist's office will look like. So just bring this up also once again into our viewers' awareness is I'm in my home office today. So I'm not in my actual office. I had a recording, I think one recording that I did in my office. We were also in the process during this whole COVID of moving offices. So that was kind of a challenge. So prior to COVID, our offices looked so completely different, and post-COVID, our offices look different yet again. So all the clients that
welcome to my new office space,
yes,
by the way.
yes.
This is the first time that I'm actually doing.
And that's what I was going to bring up is our offices look so different now. And a lot of clients that have seen our old offices have not seen our new offices yet in some ways, right? So there's almost like this feeling of, I'm not quite sure if I'm going to like it. That comes up. The other part is, yes, Brian, you are in your office. And one of the things that I've noticed a lot of clients say, those that used to wait in there, I remember the waiting area of my clients or somebody else's clients, is that the feeling of being in our offices, what I always heard, once again, my clients say is it feels very homey, like being at home, and that it doesn't feel like a doctor's office. So there's almost like, I'm doing this because it feels like home, it feels warm and welcoming. I mean, one of the things that I think we said it in one of our recordings, I don't know if you have it in your office, but we do have it in our hallway. We have in our waiting area, I keep on saying hallway, is we have tea, we have coffee. And we always say to our clients, I know I say this to mine, is you can have tea, you can have coffee, water, whatever it is that you feel like having before you come in, or even in the middle of the sessions. You want to go get it, go. We want to make sure that you feel comfortable, that we all feel comfortable in this office setting.
Yes, I remember one time a UPS guy had come into the office and he was confused. I was like, wait, is this an office or is this an apartment? Very cute. And something I wanted to piggyback. Yeah.
Go ahead.
And you know what's so interesting? Because there were clients who were in the waiting area, and if there were other patients around, also had other feelings like, what would they think of me? Do people think I'm crazy? And their anxieties, right? Or if there are other people around and what they think of each other, and until they become okay about it. But I think those are some of the anxieties when they first come into a waiting room, and if there are, other clients waiting as well.
Which I guess in hindsight we can say is not necessarily a big worry today, because we are doing telehealth. There is no waiting area. We're able to use a doxy, right? So we're using certain platforms to connect with our client, and we just send a link, and the client patient clicks on a link, and voila, they are in our office. So there's no meeting area there to, I guess, whether it's fantasize about offices, what they will look like, the part of relaxing before. So I guess that minimizes the anxiety, but there's other things that can come up with it too. The part of coming up from a work meeting and logging into therapy session, there's no break. So that's another, once again, pros and cons that come with being in person versus telehealth.
I'd like to touch a little bit about what it's like for a new client to come and sit. And I've had clients who are like, okay, so what do I do now? Do I just talk?
What do I
Essentially,
talk about?
yes.
Yes.
What do I talk about? Right. And so, if they've prepared some of the paperwork, we can say, let's start, because all roads lead to Rome, so whatever the conversation is we're going to end up talking about what's the meat of it, right? And there's no right or wrong, because in free association, the unconscious is going to bring up stories, and it will almost appear like ADHD, like, for some clients, I'm talking about this, I hope you can follow, of course, because they all add to this story, right? This dynamic story, and it's moving, and there are many parts, and we make sense of it, right? But for clients to be really aware of the time as well, that it's a 45-minute session, that they are keeping track of their time as well. So there are clocks in the office that we set so that they can too be held accountable for their own time. Otherwise, the session often, right, depending on what the client is going through, the most important or the most worrying concern is always what they want to speak at the last minute of the sessions. And then we have to abruptly end.
Yes.
Which is not helpful. So it's kind of way to so that they're mindful that time is coming up to an end. So to begin to summarize, and that the session does not end abruptly. abruptly. And we traditionally, I know for us, that we set the appointments and payments at the beginning of the session because we don't want the potency that normally happens in the end of the session, the analysis, right? Really good reflection and contemplation, and a process of what should we be practicing and preparing in this next week. Practices that are in alignment with our personality to see if it works or not. That process is not interrupted by a conversation about schedule and payments at the end, so that when the patient leaves and is driving, or when the session is done after the phone or telephone or telehealth, that there's still the momentum of those thoughts and those processes and strategies that are still going on within themselves. That's a takeaway, and I think that's something we both practice right at the end of the session. What is one thing that you will take from today that you can practice in this next week, right? So I think it's important. I think for clients to know, what does a session look like? There's beginning, middle, and end. And beginning normally feels like a little bit of small talk, depending if we are trying to avoid what we are talking about. And the middle as well is a real nice association and in regards to pattern recognition, as what we would say. There's an appreciation, but really a pattern recognition of what seems to be going on here. And then at the end, a summary of the session, and for a client to consider what to take away from that session that they can practice for the next week.
That, and also, once again, maybe I'm tapping into this part of anxiety, stressors of coming in, scheduling a session, coming in, of how at ease. Once again, I'm talking from experiences, but I think once again, I think we both probably encounter this, is how relaxed clients feel after that initial session. It's almost like you actually see the weight being lifted off, the weight of coming in and having all these stories in our minds of what to expect from therapy, what it will look like, what my therapist will look like, because we do have almost prejudgments, right, of what people will look like. And then once we actually meet, once we actually talk, it is able to be almost like lifted and ease. We feel, most clients, if not all, I guess that depends on the case, feel at ease, like the weight has been lifted off, that I was finally able to express what I wanted to express, maybe not in everything, right? Because like you said, the first session sometimes consists of just spilling, talking, or not talking at all. I think I haven't experienced that. I think for in my situations, it's always been the talking, because the reason why they're scheduling to come in is to express something's going on. And then of course, what to expect in upcoming sessions. And our structure is, right, Brian, is that we always encourage clients to come in on a weekly basis. And why is that? I think in a lot of ways, from what you have taught me, from how we have been communicating, is that the more breaks there is, the more of a check-in it becomes. That's how I usually explain that. Is the part of like, listen, Joanna, I just did this, and that over the weekend, and the session is done. If we are able to have the structure coming in, then we're able to really talk about the things that bother us, and some of the things that are coming up for us, and how we can minimize some of those things, right?
Yep. Because there is something to be said about a conversation. Too long of a stop, right? Then we lose the momentum in our thoughts. When you think of any of the support groups, right, whether it is Alcoholics Anonymous, Narcotics Anonymous, they have meetings every day, and a participant, can in the beginning especially, they're encouraged to participate as often as they can, sometimes even 3 times a day, right? So that whatever that they're working on, their coping mechanisms in the forefront of their mind, and that goal is so centered, and that their emotions and their beliefs are resuscitated. And like we can't expect to imagine if therapy was like, let me have a meal today and I'm not going to eat until next week. right? We have to give life to our thoughts. We've got to give life and breathe life and feed our desires, our ambitions, our motivations, our curiosity, our desire to heal, to be better, right?
And at least we encourage this more so in the beginning, right? Especially with the new that are coming in. For you viewers who are thinking of coming into therapy, we're not saying just with us, but just in general, if you're trying to schedule a therapist, is to be open-minded, to look at things from a positive perspective, that good things will come out of this. And how important that structure in the beginning is for us, it is the ability to see you on a consistent basis very early on. And then once things, can we say, settle down, or we feel a little bit more at ease, is eventually we go and part. I mean, that's the goal of therapy, is also to part ways, right? Is to get better so that way we can move on. And that time is also changed. It goes into bi-weeklies, or, I mean, I have clients now that call me once a month, once every 5 weeks, which we don't really call therapy, but because we have the comfort level that has been developed in there, and the client feels good about calling in just for a check-in. And that's what we call it. Check-in. How are you doing? How's your mental health? How are you feeling? Good. I'll see you in a month. So once again, I know I said calling in, but the part of telehealth is, that eventually it becomes a check-in for those that are interested.
For anyone who is contemplating seeking a life coach or a therapist or a counselor, whatever the terminology is, but seeking to have that reflection and a discovery of oneself, whether it's to work through a problem or to evolve and become more of their best selves.
And to be open towards it. There will be sessions that are great, and there'll be sessions that are a little bit more emotionally involved or difficult to talk about. But once again, to look at therapy or counseling or life coaching as self-care. This is your time. I know it's not the same as a massage. A massage, we don't have to talk. It's just receiving. But the part of talking is the ability to be mindful that you are cared for, and that you can take care of yourself as well by being in counseling or therapy. Brian, once again.
Yes. And we often have our own breathing and meditative moments, right? When we teach clients how to breathe, and the incorporation of meditation. So that too can be, a space where they learn some coping skills.
Yeah. Brian,
yes.
Thank you so much for your time.
Okay.
As always, such an appreciation. And for our viewers, once again, I hope you found this session welcoming and hopefully encouraging for any future counseling or therapy sessions that you might be seeking. We wish you well on your journey to a better mental health being. Thank you.